The most powerful medicine isn't found in a prescription bottle. It's found in the stories we tell and the communities we build together. My guest, a family physician turned public health administrator, reveals how he's bridging clinical care with community action to serve communities, and why your story might be the key to transforming public health. You're listening to the PHEC podcast, episode 426. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. Our guest today is a family physician who traded his stethoscope for community leadership. Our guest reveals why the most transformative health solutions happen not in exam rooms, but in the engagement with our communities and the stories we share with our neighbors. In case you're new to this podcast, let me introduce myself. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to their community partners, as well as the broader communities they serve. The support that we provide often falls in categories of strategic planning and sometimes capacity building, just depending upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. I'm excited to introduce you to my guest on this episode. Let me formally introduce him to you, and then I'll connect our conversation. Dr. Jimmie Smith's foundation in health began with an undergraduate degree from Johnson C. Smith University, medical degree from Wayne State University, and residency training at the Southwest Georgia Family Medicine Residency Program. He was an education staff fellow at the American Academy of Family Physicians in Kansas City, Missouri. He completed the Master of Public Health degree with a concentration in environmental health from Fort Valley State University and has completed graduate courses in educational leadership from Mercer University. These experiences have provided him with an exceptional lens in the areas of general family medicine, public health practice, and public health policy. His professional experiences include, but are not limited to, academic and public health practice. He has facilitated courses for Argosy University Atlanta, Atlanta Metropolitan College, and Mercer University School of Medicine. Dr. Smith served as an assistant professor of practice for Mercer University and as the liaison for the academic health department. This relationship was the first of its kind in the state of Georgia, helping to strengthen the links between public health practice and academia. He remains with Mercer University, facilitating courses at the master's and doctoral levels. Dr. Smith gained federal public health experience while serving as the special assistant to the Assistant Secretary for Health and 16th Surgeon General of the United States, Dr. David Satcher. He has served as the Deputy Director of Clinical Services for the Fulton County Department of Health and Wellness and served as the Senior Deputy for Health Science in the Chronic Disease section of the Georgia Department of Public Health before taking on the role of Administrator of Macon Bibb County Health Department during the COVID-19 pandemic. He maintains service to the profession by being the current president of the Georgia Public Health Association and serves on the executive committee of the American Public Health Association. He is an active member of the APHA Community Health Planning and Policy Development section, representing Georgia and Region 4 in the Council of Affiliates, and is engaged with the Public Health Accreditation Board. Let's connect my conversation with Dr. Smith right after we highlight our sponsor for this episode. Join us this November to connect with the brightest minds in epidemiology. APHA is excited to welcome you to the 2025 Annual Meeting and Expo, November 2nd through 5th in Washington, D.C. As always, APHA is diving deep into the science that drives public health. Explore sessions like tapping the potential of wastewater surveillance, advancing health equity through plant-based indices, and public health practice in sparse data environments. We'll also examine cutting-edge work in cancer epidemiology research methods and advancing low-dose radiation health effects research. And that's just the beginning. With scientific sessions, networking opportunities, and an epidemiology section career panel, you'll leave with new tools, insights, and connections to advance your work. Don't miss this chance to be part of the world's largest gathering of public health professionals. Register today at apha.org/annual meeting and use the code APHAPHEC to get 10% off your registration. Oh, hi, Jimmie. How are you? Welcome to the podcast.
I am well. Thank you. Thank you for having me.
I'm excited that you're here. I was actually thinking about this before we got on this call. We sat at the speaker's table together in D.C., and then I bumped into you at the Florida Public Health Association conference, and I was like, you know what? I need to bring him to this podcast because we've sat and rotated 2 circles over the last probably 3 months.
Absolutely. And know a lot of the same people.
That's right. That's right. And we're literally neighbors. You're in Georgia. I'm right here in South Carolina. So yes, I'm excited for our conversation. Why don't you just take a moment and introduce yourself and tell everybody a little bit about what you do?
So my name's Jimmie Smith. I'm a family physician by training. Went back, got my master's in public health from Fort Valley State University in Fort Valley, Georgia. So with that, Fort Valley focuses on a concentration in environmental health. So that's my public health background. I currently serve as administrator of the Macon Bibb County Health Department, which is located in Macon, Georgia, a population of about 155, 160,000. So that's who I'm responsible for day to day.
Yeah, that's a lot. I think that what you're doing, and I jokingly say this, and we've had these conversations about the challenges you're facing like day in, day out, just in the conversations we've had over the last few months. I would like to learn about the journey, like how you got here. So you mentioned that you're a physician, medical doctor, and then you went to public health. But do you remember when you first learned about or became interested in public health?
I do, and I would say it's probably 2 distinct periods. So I'm one of those folks, when you're in medical school, at least the medical school I went to. So I went to Wayne State in Detroit in the early 90s. When I think back on it, I can remember having 1 week out of 4 years where we talked about public health. And they brought in this guy, Dr. Silas Norman, because his son ended up in medical school with us. He was a couple years behind me. He was like the health director for Detroit. And he came over and talked about public health. And I was like, that's pretty cool. And at that time, I knew I wanted to go into family medicine. So we can do everything from deliver the baby to sign birth certificates, and we can sign death certificates. So across life's continuum. So I thought it was pretty cool, but you're a medical student and you're like, I'm just trying to make it to graduation. I've had enough of this. And then when I got in residency, I actually came down to Albany, Georgia, because it's way too cold for anybody from the South to have to go to Detroit and do school. And as soon as we get done, we come out. So I came down to Southwest Georgia and I started looking at the community and those things and the folks that were coming in and the diseases and illnesses I was seeing. And so I started making some decisions about my practice and realized this kind of goes back to what Dr. Norman told us about public health. So give you an example. As a resident, I went to the residency director and was like, I don't want to see kids during the day. I will stay late, but they get out of school at 3:00. So why am I doing a sports physical on a kid at 10 o'clock in the morning when they need to be in math? Or we're doing that kind of work. Can I schedule them all at 3? I will do that. Because one of the things I required of my students was if you were between kindergarten and 18, you had to bring your report card to the office. And that became part of your medical record. Because if you were physically fit to run up and down a football field or play volleyball or cross country or softball, but you were failing English, then as a family doc, I haven't done you a service if I don't say anything about it. Or I would tell my students, I might show up at your game. And there were days that I would. Or I might show up at a PTA meeting because I want to hear, how do you have a 62 average in English, but you start a football team? That doesn't make sense to me. I didn't grow up in a world like that. So part of it, when I was in residency, I started gravitating toward public health. I luckily had a residency director that encouraged that. So in my free time, like I'd hang out at the health department and got to know those folks over there. But he also encouraged me to look at advocacy and policy because he said everything can't be done in the exam room. So there are times when you have to speak to folks outside of that venue. And that to me is what really public health is.
I love that. You actually took me back to a couple of glimpses of my childhood. Like that was what it was like in my family. It was all intertwined. I think, I don't know about, I guess it's something about the relationship that we had with our caregivers, the doctors and the teachers, and just all overlapped within the family unit. So I wish I had someone like that with my kids. When they went to the doctor, they had to bring their report card.
Oh, yeah. And I mean, we held them accountable. And then the
Yeah.
kids they would chuckle very quickly. Then they would stop when they got that look from their parent. And I'm like, well, when was the last PTA meeting? And the parent was like, well, I don't know. I don't go to those. And I was like, why not? So then the kid would think, oh, you're getting on the parents too. He's kind of cool. You know, they won't say anything back to him, but you do it respectfully. But you're like, you know what? That's important.
Yeah. Is there a particular population or condition or public health problem that you're most passionate about now?
With present day activities or / shenanigans that are going on,
That's a good.
I would dare say those issues that fall somewhere under the umbrella of diversity, equity, and inclusion, which I think is a very good link to those social determinants of health. So all of those things that don't carry a medical diagnosis, don't have a international classification of disease number that you can put on it, are important to me. And as I told a group last week, because they were studying diversity, equity, and inclusion in this leadership program, and I said, you know, those are kind of hard words to say in some arenas.
Right.
But I said DEI can also stand for decisions, empowerment, and imperative. And we're still doing the same work. So, okay, you don't want me to say those, but let's talk about the decisions we're making and what are we empowering folks or are we taking power away from folks? What are our imperatives? Do we want folks to be healthy? I live in a state where our governor touts our state as the number one state in the country for business. That's great. It brings in economic dollars, but I also tell our local chamber of commerce, you can't have a thriving business with a sick society. Your staff's just not going to be there. So in terms of a population, I won't say fight. In some days you fight for, I say other days you fight alongside those folks that maybe don't know that they have a voice. And what you do is you lean on the door long enough to show them, here are your resources. Because maybe they've never peeked on the other side of the door to see them. Or there are things on the east side of town that are not on the west side of town, or leaders on both that never talk. And as public health officials, we ought to be that folks that can bridge that gap. So I like using I know you know the public health 3.0 model, trying to be that chief health strategist. And sometimes you get your hands in the weeds sometimes, but there are other times where you just kind of move the puzzle pieces. And you have to do it, and you always need to be 3 or 4 steps ahead, just so you can say, I need this person to be here today so that I know that they can meet this person next week in this meeting. And then while they're there, it's like, hey, while the 2 of you are here, did you know? And get the 2 of them to know.
It works. It feels like we're constantly like wrangling the toddlers to pull it together sometimes. But those are important connections and points. Let's talk a little bit more about your current role. And you touched on that in your introduction. Can you talk a little bit more about the work that you're currently doing, who you're serving, maybe some of the programs, services?
So Georgia's a state with a lot of counties. So I'm responsible for one county. So in our state, we have 159 different counties. So it's interesting that public health is the only health agency that is present in all 159 counties. We have many counties with no hospitals, no doctors, no nurses, no dentists, mental health providers, but the health department is there. So in my administrator role, I look at it again as that chief health strategist. Mine is to try to set the vision for the department. I certainly do that for my county, but I can't do that in isolation because our patients may come from multiple counties. People may work in different counties. So I need to have a regional perspective. And then through that and some of the other experiences I've had, it's allowed me to take a bigger look at Georgia. So that's my role in like Georgia Public Health Association and also with APHA. If you were to look at our services, you would say they're pretty much the traditional local health department services, which are very heavy on maternal and child health. very low on men's health overall as a specialty. I'm fortunate that in our facility, for all those we serve, we have right now about 55 team members. On our clinical side, I have 2 nurse practitioners, 1 LPN, 5 RNs. We have a WIC office that services our caseload. We serve almost 4,000 people a month through WIC, between the women, infant, and children. I don't count people as they come in the door. I count services delivered. So our nurses, even though we are short on team members, we're providing a little over 900 to 950 clinical services a month. Our front office staff or our admin staff is who supports those folks as they come check in and make it to our clinical team. I'm fortunate to have a dentist 3 days a week. I have a dental hygienist 5 days a week. I have 3 health educators, one that focuses on childhood injury prevention through our Safe Kids Coalition. Talked with her this morning. So around town, she's known as the car seat lady. So she has a certification to not only install seats, but as an instructor to get other technicians certified. But by the last state report for this county, we have put more car seats in the hands of parents than any other county in the state. Here, we also have an environmental health team, which most people think only check restaurants, but there's 11 different programs that are handled out of that office. Everything from they work with animal control. We're responsible for reviewing building plans, testing water, rabies investigations, a part of the animal control work. Yes, we are responsible for tourist accommodations. So those hotels, motels, campgrounds, tattoo parlors, we're responsible for. And right now we're sitting at 693 permitted restaurants in this county. I've got 10 folks and they handle all of that. The last office we have here is we are the vital records custodian for the county. In most counties, you have to go to probate court to get your birth and death certificate. We can issue those from the health department. So we can issue them statewide. So they average moving about 1,100 pieces of documents a month.
That's incredible.
We stay busy.
All right. I'm listening to you and I'm thinking, you kind of touched on this a little earlier when you began to talk about how many counties you have and the fact that not every county has like a hospital. So that people who live in one county could be traveling to a different county for hospital services. And it got me thinking about collaboration. And I'm wondering how you collaborate with neighboring counties because different jurisdictions, using my air quotes. But then also, I think on a little bit larger scale, I think about that here in South Carolina, we have counties, but we also have regions. But there's always this need to collaborate with the neighboring county and then maybe even the states. When you have a county that bumps up on the border of Georgia and right next to Georgia is maybe South Carolina, and there's that people are moving between the two. How are the collaboration efforts between the counties and then maybe even beyond?
I think they're not as structured as they should be. They're not as prevalent as I would love them to be. But in terms of those partnerships, so if you take the state of Georgia, 159 counties, those 159 counties are divided into 18 public health districts. So whereas you have regions in South Carolina, we have districts, but we have 18 of them. So if you think of a place like Atlanta, which is Fulton County, that's one county, one district because of the population. Where I am in central Georgia are 13 counties, which has a population, those 13 counties make up about 550,000 people, makes up what we call the North Central Health District. You could go down on the southeastern part of the state, and there's a district that has 16 counties in it. It takes 2.5 hours to ride from the district office to the northernmost county. That's just to get there. So you're not having an 8:00 meeting. You might schedule that for 11. You want to be gone by 2 because it's going to take you 2.5 hours to ride back home. So what I do with that in terms of local, in our district, we certainly are kind of managed by our district office. So certain programs come through there that every health department touches, but also believe in that chief health strategist role. So I seek other partnerships because I think we have to have those interdisciplinary partnerships. So as we talk about those social determinants of health, there's a group here called Home First, which helps first-time home buyers fix their credit if they need to, talk about the home buying process. Every year we offer that, and I try to first fill the class with public health team members. we can't fill it up, then we open it up to everybody. But when you walk away from that 8-hour class on a Saturday, you also walk away with a certificate that guarantees $12,000 toward your down payment. So those are the kind of partnerships I seek. I would say I have probably about 6 different jobs that I do, 6 different hats that I wear. So one, I'm also an academician. So I've taught for the last 15 years public health, undergrad, master's, and now doctorate level for Mercer University. So part of that is we have an academic health department with the university, which gives me access to almost 100 undergrad students, about 50 master's students, and about 40 doctoral students. So that increases our capacity for research or for projects that the students can work on. I can precept, but I try to always make sure that that's going to be of some benefit back to our health department while they're going through what we call an applied learning experience. So they're going to get something out of it, whether it's a presentation or a poster that they can do. But I want to make it something germane to their work. We certainly partner with a number of civic and social organizations. Just a couple of months ago, we partnered with the Alzheimer's Association here in Georgia to do a kind of a huge awareness event. And what I thought, I was like, maybe 15 or 20 people will show up. And we had over 200 that came out on a Saturday morning to hear what are the different types of dementia and Alzheimer's, and how they heard from caregivers, they heard from researchers, they heard from organizations that provide resources to caregivers. So those are the things that we try to do out in the community, such that it's not just a come to the health department for clinical services.
Well, thank you for that. It's a very interesting approach, but there's that collaboration. We're all interconnected in how we collaborate and how we lock arms with other partners to better serve our populations. It may look differently, but it's still an important value of being able to, not try to do it all yourself or just, think that you can confine it to whatever the restrictions are, but just being creative in how you help meet the need. That's what I'm hearing.
And one of the things we do, I'm fortunate in that there's a gentleman here that worked in our business office for the district and also handled facilities. So several years ago, he went on this journey to try to refurbish, rehab many health departments. So in local county health departments, many times it's an old county building. As a kid, I used to like going to the health department because it was like a playground. It was usually an old county building. None of the chairs looked alike because they were probably the surplus chairs from every other department. Some sat still, some rolled, some spun around. So for a kid, it was kind of cool. Your mom couldn't be looking because you'd be playing around in the furniture. But I will dare say this health department that I'm fortunate to be the administrator of, there's not another health department that looks like this in the state of Georgia. So it was a renovated orthopedic office. We've gone so far as to, even if someone has never been here but was interested in public health, we created a video where we flew a drone through the building for like 8 hours and then worked with Mercer University's foreign language department to do the voiceover in English and in Spanish. So you can see our, health department, know what the exam rooms look like. From a clinical standpoint, one of the issues we face in Georgia is particularly not so great maternal mortality statistics when it relates to particularly African-American women in childbirth. So in a month and a half, there's the Georgia Black Doula Network. We'll be using our facility to train over the next couple of months. So they'll be coming in on Saturday. Those are, I think, the kind of community partnerships and collaborations we need to do. It doesn't mean that we spearhead it, no. But I've got a training room with all of the AV equipment that sits on the weekend. So if I can bring folks in and let them use that space for the benefit of not only this county, but the state, then we're going to do so.
That's great. I like that. So let's shift a little bit. This is great. And this is where you talk about connecting the dots a little bit to public health, epidemiology, other industries. How do you explain the importance of the work that you do and its connection to public health and or epidemiology in conversations with family, friends, and the general community?
Hard one.
Yeah.
Probably hardest for my parents when they were living, and they were like, you went to medical school. We were at graduation. Well, you don't have patients coming through your door. Like, we see your name on the door, but patients don't come in to see you, and you don't wear your white coat anymore. I'm like, no, I don't do that. And I joke with my friends, even my clinical friends, we're all in the same business. I just have the largest practice in town.
There
I
you
have
go.
160,000 every day, and they
That's
don't always
right.
want to see me coming. So when I have that conversation, I certainly started off by trying to explain the difference between clinical medicine of you going in the exam room, seeing your healthcare provider versus public health, where we still provide clinical services, but we take a more population view. I'm looking at the whole community, not just one person, one family at a time. And that can be difficult even for a family doc. So what I asked them to do is I need you to do what I have to do every day, and that's look through a different lens. So a surgeon, when they go in and do surgery, everything is covered except for that little piece that they're working on. Public health, when we go, we want to pull back all of the covers and we need to see everything. This one area might be the issue, but I need to see everything else around it because it's attached and affected in some way. And then I think the other thing is, how do you explain that to others? You become a very good storyteller. So when I'm talking to the business community, I may tell a story, but I may tell it in a very different way when I'm in front of public health students. I may tell it a very different way when I'm at a high school and they're saying like, okay, so you went to medical school, but what is public health? And making them understand that. The same way an epidemiologist does when you're like, okay, I'm seeing these folks catch pneumonia and the rate is this, and there's prevalence and then there's incidence and everybody gets this glassed over look. We get that quite a bit. So we have to be great storytellers. We have to show that we're looking at a much broader population and what that means and why that is so important.
I like that. You and I are both at Policy Action Institute in DC, and I tell this often. I've said it multiple times on this podcast. But, one of the big takeaways for me as moderator, so I had these multiple panels over the couple of days, different groups of lawyers, legislators, just a diverse group of folks on different panel discussions. And the consistent takeaway from those 2 days, I heard over and over and over again, the need for stories. Tell your stories. The need for the politicians. And it didn't matter if they were red or blue states. They were all saying the same thing. We need your stories to share, to advocate for whatever it is we're trying to advocate for. We need your stories to humanize this process and to share back and advocate. And so I like that you're automatically, incorporating that in how you're explaining this to people. And you're right at the very beginning. I agree. It's a tough question because this is not necessarily an easy thing to do, but I'm asking everyone this. I push through it all the time because we have to get better at explaining public health to people to help them understand what it is before we can even look to value for people to value it more. In the future, if we fast forward ahead, we don't want it to be so easy for it to be cut out.
Yeah, and it's a tough discipline because many times there are parts of what we do that folks don't want to see.
Right.
You're sitting in a restaurant having a wonderful dinner, but you happen to notice this person that like kind of walk around maybe behind you and walk toward the kitchen, but they have on this little badge. And then you kind of glance over, it's like, oh, this is DPH. Maybe that's Department of Public Health. And then you notice they keep going in and out of the kitchen with this little clipboard. And then you start wondering, like, should I be eating here? Why are they keep going in and out? Much of our work is done behind the scenes. Much of our work is done in prevention. So when you come to dollars and cents, you don't always see it. And that makes it difficult for folks to understand. We don't necessarily cure things. We manage things.
Mm-hmm.
And we have to manage them, very well. We have to, aside from public health, one of the most underfunded and underpaid staff is public health and like school teachers. Nobody remembers the third grade teacher except the student because of what they poured into them. If you ask your parents and say, can you remember all my teachers' names? They may not, but you're going to remember a few. That's what public health does. When we touch someone in a very positive way, they remember that interaction. For me to go downstairs, I'll be the first to say, I don't like going to the dentist because it's just traumatic for me, but I have to go. But when I see a 4-year-old walk in the door and our dentist meets them at the door and the kid throws up their arm and runs to give the dentist a hug, that's pretty cool because now they've had this interaction where they like going to see Dr. Stone. When I go downstairs and there's a lobby full of screaming babies and 2- and 3-year-olds and everybody's scratching their head like, it is so loud in here. That is the most wonderful thing to hear in the health department. Because now if we can teach them as little kids, they will come back to us for that care because they know we actually do care.
Yeah. So, our audience of podcast listeners is pretty diverse. We have students, professionals of all levels, from early career to senior, and entrepreneurs mixed all in listening. And then some who are really kind of outside of public health and just wanting to understand. But is there one bit of advice or tip that you would give to someone who may be listening now to this conversation and may also be interested in doing similar work that you're doing?
I've got a couple. And actually, these are some I shared with some new epidemiology fellows at Emory 2 Fridays ago. So one of the ones I told them was, one, in your career, seek experiences, not positions. And that's something I learned from Dr. Satcher when I was able to work with him. And he's still one of my mentors today. And I got that because a young medical student said, if I wanted to be Surgeon General 10 years from now, what do I need to do? And his answer surprised the audience of 1,500 students. And he's like, first thing I would tell you is don't seek to be Surgeon General, but seek to have the experiences that if the call comes, you have a broad enough base and an intact reputation where, one, you will get that call. And then you decide whether or not that's the experience you want to move to, or whether, your skill set will let you do that. The second one would be, and this is a tough one, if service is beneath you, then leadership is beyond you. And it's tough because folks are like, well, I can be a leader, but I don't necessarily have to do all the other stuff. Yes, you do. You're not going to be the expert at every job that's under your purview, but it's still service. And the first service that I have to handle when I come in here every day is making sure that my team has all the tools they need to be successful. And that's a service to them, because when I'm providing that service to them as best I can, then they can do a better job of providing it to the public. I guess the other ones would be, one, for someone that's, say, younger in their career or trying to decide if they're going to make a change in their career, is when you have your vision, don't let a blind person proofread your vision. And by that, I mean, if you say, hey, I want to be an epidemiologist, but I really want to use it in this way. A person that's never thought about it in that way is going to say, well, you don't need to do that. So you're kind of letting that person that doesn't have that insight proofread your vision. I would dare say when you were going to school to learn to be an epidemiologist, that if somebody had said, you're going to be doing podcasts in 20 years, you'd have been like, no, that's kind of not on my trajectory. I tell my students when I see them, I was like, you may not see it now, but I can look at you and tell you some of you are going to be faculty members and you're going to be teaching public health to other folks. And they were like, I'm just trying to make it out of your class. I am not trying to teach anybody else. And now I've got folks that are college professors. I had a young lady a couple of weeks ago. We've been talking she's graduated 7 years ago, and she always wanted to be a dentist. So every year she calls, she's like, will you just write me one more letter? Because I want to go to dental school. And I'm like, I will write a letter until we run out of ink. And then she called me and said, hey, I got on the waiting list. And I said, well, a delay is not a denial. You just keep your faith. And then she called me sent me an email one Wednesday night and said, I got an email. I got him off the waiting list and I'm going to dental school. And she started the next Monday. So all I asked her was, I said, I want you to do this. On Sunday or Monday when you get up before you head off to school, take a picture of yourself. So kind of like you did, your parents used to do kindergarten, first grade, all that stuff. I don't want you to send the picture to me, but I want you to keep that picture. Because 4 years from now, when you're about to go across that stage and they're about to call you Dr. So-and-so, I want you to remember where you came from and that journey was even possible. So part of that is don't, for all the folks that said, you don't need to apply again, you're not getting in. Don't let them proofread that for you. And then the last thing I would say to folks is, particularly in this time, but it's every day. It doesn't matter who's in the White House or who's in the governor's office. One, remember that your integrity is not negotiable. Don't negotiate that. Honesty is not an option. We're honest every day. And then 3, your character is not a liability. So don't let your skill set keep you in a place where your character won't allow you to stay. It's okay to move. Our grandparents kept jobs for 30 and 40 years. Our parents probably did it too. But this is a very different generation, a different space that we're in. Don't let your skill set keep you where your character just is bothering you every day. It is okay to seek other opportunities.
Well, you just dropped a lot of gems. I love everything you just said. I hope our audience is taking notes. Very generous on this. Thank you so much for your time, your insights, sharing your journey. It's been very inspiring. And I look forward to keeping in touch for sure. Last question is simply, what is the best way for our listeners to connect with you?
I'd probably say the easiest is on LinkedIn. So I am on there. It's Jimmie, Jimmie, Smith Jr., and it'll, this little big ugly picture will come up. And it's Macon, Bibb County Health Department. But no, I'd be glad to hear from you, and maybe we might know some of the same folks, or we can share ideas or, partner on something.
Wonderful. We'll make sure that we provide the links to your LinkedIn in the show notes page, and I'll tell everyone how to get to that in just a moment. Thank you so much for making time for us and for being on the podcast.
No problem. I've had fun this afternoon.
I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Dr. Smith and learn more about the work that he's doing. When you reach out, be sure to let him know that you heard his episode on this podcast. You can find the links to connect with him on the show notes page. The show notes page for this episode, which is episode 426, can be found at phecpodcast.com. Once you're there, just navigate to episode 426 to find the show notes. One more thing before we go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals around the world. You can download the new PHEC Podcast Community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.